Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Neutropenia is a blood condition. It means you have a low level of neutrophils. Neutrophils are a type of white blood cell. They are very important for your immune system. Neutrophils fight off infections. When your neutrophil count is low, you are more likely to get sick. Neutrophils are made in the bone marrow. This is the spongy tissue inside your bones. They travel in your blood to areas of infection. Think of them as your body's first responders to infection. Neutropenia can range from mild to severe. The lower your neutrophil count, the higher your risk of serious infection. It's important to understand neutropenia and its implications. Early detection and management are crucial for preventing complications. There are many things that can cause neutropenia. Some common causes include: some treatments can damage the bone marrow. These include chemotherapy and radiation therapy for cancer. Certain medications, like those for hyperthyroidism, can also lower neutrophil counts. Infections can suppress the bone marrow's ability to produce neutrophils. This can be caused by viruses, bacteria, or parasites. Examples include HIV, hepatitis, tuberculosis, and sepsis. Some people inherit genes that cause low neutrophil counts. This is seen in conditions like cyclic neutropenia and severe congenital neutropenia. In autoimmune diseases, the body's immune system attacks its own cells. This can include neutrophils. Examples include Crohn's disease, lupus, and rheumatoid arthritis. Not getting enough of certain nutrients can affect neutrophil production. This includes vitamin B12, folate, and copper. Disorders that affect the bone marrow can impair neutrophil production. This includes leukemia, lymphoma, and aplastic anemia. Understanding the cause of your neutropenia is key. It helps your doctor determine the best course of treatment. Neutropenia itself may not have obvious symptoms. It's often detected through a routine blood test. However, because it increases your risk of infection, you might experience: this is a common sign of infection, especially in people with neutropenia. Chills often accompany fever and can indicate a serious infection. Feeling very tired is common with infections and neutropenia. A sore throat, especially with swollen lymph nodes, can be a sign of infection. Sores in the mouth, gums, or around the anus can indicate infection. Redness, swelling, pain, and pus at a wound site can be signs of infection. Pain or burning during urination, frequent urination, and urgency can indicate a urinary tract infection. If you experience any of these symptoms, especially fever, contact your doctor immediately. Prompt treatment of infections is critical in neutropenia. Section 4. Diagnosing and treating neutropenia. Diagnosing neutropenia starts with a simple blood test called a complete blood count, or CBC. This measures the number of neutrophils in your blood. If your neutrophil count is low, your doctor may order further tests to identify the cause, such as bone marrow aspiration and biopsy. This procedure examines the bone marrow to see how well it's producing cells. Genetic testing can also be done to identify genetic mutations that cause neutropenia. Treatment for neutropenia focuses on addressing the underlying cause. Treating infections is crucial, and antibiotics are often used for bacterial infections. Growth factors like G-CSF can stimulate the bone marrow to produce more white blood cells. In severe cases, you may need a transfusion of white blood cells. Additionally, lifestyle changes such as eating a healthy diet and getting enough rest can support your immune system. Your doctor will create a treatment plan tailored to your specific needs. Section 5. Living with neutropenia. Tips for prevention and management. Living with neutropenia requires vigilance and proactive measures to prevent infections. Here are some tips. Wash your hands frequently with soap and water, or use an alcohol-based hand sanitizer. Stay up to date on all your vaccinations, including the flu shot. Limit contact with people who are sick, especially those with contagious illnesses. Food safety is also important, so wash fruits and vegetables thoroughly, and cook food to the proper temperature. Clean cuts and scrapes immediately, and keep them covered until healed. Regular monitoring is essential, so see your doctor regularly for blood tests to monitor your neutrophil count. By taking these steps, you can significantly reduce your risk of infections. Remember, knowledge is power. Understanding neutropenia empowers you to take control of your health. UMCC, your ultimate medical consultant connectors.